Good afternoon. Thank you for joining us here on this Thursday afternoon. We're typically bringing you some type of a message or something from our sanctuary, but tonight it's very important that we bring you some information because we're excited. We're getting ready to reopen our sanctuary. That will be happening on May the 31st, Sunday, May the 31st. So we felt like it was very important so we could come to you tonight. I'm Pastor Mike of the Crossing. This is one of my associates, Josh Dudley. He is our systems and operation pastor, but he is also a registered nurse here in the county. So we're just glad to have him, and we wanted to come and bring you some thoughts about our reopening. There's been some question about the reopening of our sanctuary, and it is just that. It was kind of a funny thing. Somebody had said, "When are you opening?" And I said, we've never not been opened. We're just going to be reopening our sanctuary. We have been doing immense outreach, just a terrific amount of outreach and working towards helping people in the community. And also, my staff can vouch for this. It has been a tremendous struggle and to work just to get these videos and messages to you, as we've said before. So, once again, I just want you to know it's important to me as your pastor to be able to express to you and give you the information that is necessary for you to be able to understand where we are and how we got here as the church. So we are reopening our sanctuary. We have never been closed. But the reason we closed our sanctuary is for two reasons. Number one, the first reason we closed the sanctuary was back when this pandemic opened up and happened in our country, and we realized that it was worldwide. Our President Trump, came on and asked us to simply be very cautious and give us a little time and close the sanctuary where we gathered as a group. So we did that. That was the number one reason that we actually closed the sanctuary, so that we could figure out where we were as a country, how this was going to affect our communities and obviously our church. And now we've kind of progressed down the road. And here recently, Governor DeSantis of Florida began to lift some restrictions, and he said to the church, he said, we are not pressuring the church to close, but we are asking you to please use caution. So for those two reasons, I felt as a pastor that it was necessary for us to close the sanctuary and continue to do this. One thing is for sure, this church has grown spiritually through this pandemic. If you don't think anything's going on, and sometimes there's a pressure to reopen maybe quicker than is necessary, but I want you to know that, there's over 2 million plus cases of this virus. Hundreds of thousands of people have died. So this is no joke. It is a real issue. And so as the pastor, the second reason I wanted to come to you and bring you is we have to show prudence as a church. When we asked you to come and do something, when this pandemic turned deadly, we realized that in 2 weeks people were dying, they were getting infected, and in 2 weeks' time they were dying from this infection. And so we began, if we have a responsibility when you are a 501c3 organization or corporation and you have insurance that covers you, you have to show due diligence. For instance, if something happened at the church and someone did get sick and we ended up in a lawsuit for some reason, we have to really understand that we live in that kind of a world, that if we got sued, they would ask us, well, what precautions did you take, Pastor? And so we wanted to be able to show, if our insurance company asked us that, why we closed our sanctuary, was to do due diligence and prudence as a 501c3 organization. So now you as the church have been bored stiff with the reasonings why we closed, but I just felt it necessary for you to have the information as to why we closed our sanctuary. So what's going to be happening? Let's get off of that and move into May the 31st. It's going to be exciting. And we are thrilled to be able to get back together with you. Missed you immensely. it's been very difficult to be away from you physically, but now's our opportunity to come back together. And so when we do that, things are going to look a little different. The first thing I want you to remember is this about coming back together. We are going to have 2 services on May the 31st. So that Sunday morning, you will have the option of a 9 a.m. service or 11 a.m. service. And we're going to be giving you an email address so that you can register, you and your family, how many will be coming with you for that service, whether it's 9 or 11. That we want to make sure that we continue to use wisdom as we move forward. So we felt like giving you 2 options as a service would be wise to do so. This may change. It may go on for a month, or it may only last for that 1 week. We will see how things go, but we just want to give ourselves a little space and a little some options to make sure that you are as safe as possible when you do come back. We're looking forward to a fantastic service, but we just want to make sure that as your church and leadership, that we have done all we could do to ensure that it is a safe environment for you to come back to. And we want you to know that we're doing everything possible to make sure of that. One of the blessings we have here at the Crossing is to have Brother Josh, as I said before, who is a registered nurse who works in the field every day. And so at this point in time, I wanted to kind of give it over to him so he could kind of go through some of what things are going to look like when you get back to church on May the 31st. So Brother Josh, you want to cover a few things there? I think it will help our group.
Well, Pastor, first I want to thank you for, taking time to address this and making, not only spiritually responsible decisions, but also making responsible decisions from a medical perspective. Because it truly is a pandemic. It's something that no one on this earth is not affected by. So I just want to shed some light on that. I just want to communicate. I work in public health. I actually assist in testing individuals that could be, positive with the COVID-19 or the coronavirus. But just so you're educated as you come forward, one of the ways that it's transmitted is if you're in close proximity or you're near someone who is in fact positive, Pastor, and they were to cough or sneeze or even talk, and if droplets were to exit their mouth and get into your airway, then you could potentially be infected. And secondly, it occurs when someone may cough in their hand and touch a door handle, and you come behind them and grab it, and then you touch your face, or you eat something, and you wind up actually becoming positive that way. So it is from person to person contact, so that does create challenges, when you're in a church setting, and I appreciate you taking this, head on, because we want to do everything we can to be responsible, to protect not only ourselves, but the members of our church and the members of our community, because as it moves person to person, you never truly know who it'll affect when it's all said and done. And those things, just as I mentioned earlier, if you touch a contaminated surface and then touch your face, one of the biggest things you can do is frequent hand washing. Wash your hands before you eat, before you touch your face. If you have hand sanitizer, you need to use that. It needs to be at least 60% alcohol. That way it has the ability to kill the virus. So just being responsible and diligent about that. If you're in public or when you come, CDC guidelines encourage the use of a mask, cloth masks, or if you have access to the medical type, you can wear those. And that's to prevent, the droplets from entering your airway. People have even asked me about gloves and talked about those. If I were to put on a pair of gloves right now and I were to walk around this church and touch surfaces, if I didn't change my gloves between every time I touch the surfaces, Pastor, then that glove could be contaminated. So it's not really wise or a good decision to just wear gloves, especially if you're not changing them. Us in the healthcare profession, we use them between every single patient, which is coupled with hand washing or using hand sanitizer. So gloves are if you're doing frequent hand washing, I would say leave the gloves off, and then social distancing, making sure, while you're at church, you're not hugging, you're not shaking hands, because you don't know what that person's come in contact with. And if you're diligent and responsible with your own self and be conscientious of what you've touched, then you can prevent the spread or even contracting that. If there's a time of prayer or special prayer, that really needs to be handled by you, Pastor. That, you need to come down and you need to take care of that. That way, we all in our heart want to take care of people spiritually and help people through difficult times. But, just being responsible with that. So, those are some of the low-hanging fruit with this that I wanted to touch on. We're going to be cleaning between our services, making sure that all the door handles are disinfected. That's from the front door to the back door to the bathrooms. And just any surfaces that are frequently touched, they're going to be sanitized. So we're doing everything we can to prevent the spread of this, from a medical perspective. Pastor, do you have any questions or anything you'd like to touch on?
Well, the things that we wanted to make sure, my objective asking Josh to talk to you from the field, the medical field, is so that you understand that what we're doing spiritually and physically is necessary. It's not just something we picked up, hey, we're just on a whim here. This brother is in the field. He is seeing it every day. It's real. Okay, it's real. It may not affect me like it would someone else, but as I said, we can't take the risk without making sure that this church has done everything possible to say that if someone did get sick, that hey, the church did everything possible to make sure you were safe. So when we come back to church, as he said, we're going to not be shaking hands or physical contact, hugging, as we like to do, because I like to be physically engaged with the people of the church, and so for now we're going to have to kind of just put that on hold. As Christians, it's one thing to have brotherly love, and that's the reason we do those things. But when you come back, here's what's going to happen. When you walk in the door, someone will meet you at the door. An usher will be there. Those people will be having a mask on. There will be no gloves, but they will have a mask on. And so when you come into the sanctuary, they will address you and glad that you're here and move you towards one of the ushers. And so from there, an usher will seat you in the sanctuary. We're going to be keeping somewhat of a ratio of how many people we can put in the sanctuary, but we're going to be using the social distancing to make sure that that's done. The reason we're doing that is it's necessary for us to do it. Once we get in here, we'll have church. But until then, let's make sure that we've done everything we can to be safe. So, Josh, the ushers, when they have someone, they'll be seating them, and from there, yes, I guess we're keeping ourselves at a little bit of a distance on the pews as well. Am I correct about that?
That's correct. Yes, sir. We'll be doing that, just maintaining that social distancing, because someone were to sneeze or cough up to a 6-foot range, that can actually be spread. So.
Okay, so if someone needs to get up, certainly you're free to do so, the restrooms and things of that nature. We are asking that you'll be seated as a family. So if you come in as a single person, you'll be seated probably on the edge of one of the pews or the chairs that we have. And if you're a family, we will seat you on one row together, whether you have children or not. We don't feel that it's safe enough in our minds to put the children all together right now. So the service will look different like that. We will not have children's church or a nursery, but a room available to you if you need to go out. And that room will be sanitized. And when mom uses that room for the children or whatever, and when she comes out, someone will clean that room immediately, so that we keep, like I said, as much opportunity rather for this virus to be transmitted to you as low as possible. So church is going to look a little different to start with, because we are insisting on it. One thing I want to say is that the government has not pressed us at all. Our country is in a crisis. This has affected people in a terrible way. And so I've been very thankful for how the president has handled it and the governor has handled it. And so as pastors and leaders, we've just tried to say, hey, we're in this together. And we wanted you to know, as your pastor and an assistant as a pastor as well, but not just that, someone in that medical field that can say, hey, the Crossing's doing it the right way. I see it every day. So we're going to be opening up on May the 31st, 2 services, 9 a.m., 11 a.m. You will have an option to sign up for one of those services. We'll fill up the first service first. Once that's full, we'll shift you to the second service, and you'll be notified as to how all that's working. It'll be very informational. You'll have an option to get on there and know whether or not your registration went through. We'll contact you and tell you that, hey, you're set to go at 9 a.m. on the 31st. And it's going to be fantastic. But we just wanted to come to you tonight and give you some information to be thinking about. Now, in the next few days, we will be posting on our Facebook this information, highlighting it in written form so that you can see it also without just trying to listen to the video again. So we're trying to give you this information down the road so you can prepare. We've got a couple of weeks. We need to do some heavy cleaning here at the church. We need to set back up. It has been a spiritual war room here in the sanctuary. Things are just moved around so that we could get you this information and people could preach and share the gospel with you. And it has been fantastic. All of you know that we have gained many friends on Facebook and YouTube, and they have been joining us on Sunday, and powerful things have been happening. People's lives are being changed just through this time together. This church has grown spiritually, as I said before, and I'm so excited about that. If you don't see a pandemic, then you've just been looking at something nobody else is looking at. God is using this to bring the church to a more powerful position. You know, I was thinking about Daniel, and I'll close with this thought. You know, when Daniel lived in Babylon, he had a king that cared nothing about God. But the Bible says that Daniel handled himself wisely. And by doing so, that king looked to Daniel. And that's what we're asking this church to do. If we can handle ourselves wisely, no telling who's going to say, hey, let's call them when they need some help. That's what we tried to do here at the Crossing. That's our intentions. We are going to be reopening our sanctuary for you to come together, and we're going to have church. Oh, we're going to have a great time together. I believe God is going to bless us, pressed down and running over. So you get ready. 2 weeks away, I believe. It's going to be a great time coming together. 31st, May the 31st. We'll be giving you the information for you to register for that service. Pray for us. God bless you. Thanks for giving us a few minutes of your time. God bless. We'll see you soon.